Greetings, you wonderful, curious people out there interested in ocular issues that may affect you or your family or your loved ones. Today's topic will be styes. Common, most people in their lifetime will get a stye, and we're going to talk about what they are and our treatment regimen, or how we go about thinking about styes and what do we tell our patients. So, John, what is a stye?
So a stye, I mean, when many people come in and they see what they'll describe as a stye, technically we call it either a chalazion or a hordeolum, all these Latin words, which not that important right now, but basically it's a clogged gland. There's glands in the eyelids, both the lower lid and the upper lid, that are called meibomian glands. Those glands at any time can become blocked. If they become blocked, they swell, almost like a pimple. So to me, a chalazion or a hordeolum or a stye is essentially like a pimple in the eyelid. It's a little different in that it can last a long time. We all know as kids we had pimples. I mean, the longest pimple I had, I mean, probably was a week, but I've had patients that have had styes for 6 months. So I think it is different, but it's very similar. And when someone has it, typically they'll notice discomfort, almost like an ache or pressure in their eyelid, either the upper or lower lid. And I tell my patients, it's almost like your eyelid's pregnant. It's growing from within and it's getting really thick, and it hurts from within. And in terms of treatment, for me, most people will respond to warm soak. So I tell them either to take a hot potato or a hot washcloth or a hot tea bag, not hot enough, obviously, that it's going to burn their skin, and hold it on there about 5 minutes at a time, 4 times a day with gentle pressure on the stye. And we're giving out big secrets here. I mean, I'm pretty busy in the office seeing lots of people that come in and pay their copay and they want to see me, but there's a secret out there. You don't need to see me for this. If you can make that diagnosis on your own and you can soak it, there's about a 90% chance if you soak it 4 times a day, it will go away. Now, if it doesn't go away, well, that's different. That's something we have to consider some options. And Carl, he's an expert in this. He's an oculoplastic specialist. Why don't you tell us what you do for those ones that are there more than a few weeks and the person's really bothered?
Right. So I'm an oculoplastic fellowship trained guy in Alaska. So my practice is a referral practice. I'll see ones that are stubborn that other ophthalmologists or optometrists would like me to take a look at. And like John, the best thing is to use warm soaks. Medication comes next, but it really doesn't work in my experience. I like to go to doxycycline.
I would add one thing. Sorry, Carl. One thing, I mean, some doctors definitely advocate right off the bat doing things like erythromycin ointment or even oral antibiotics. It's controversial. I mean, antibiotics are really not indicated for a non-infectious issue. If the doctor's not sure, if they think there might be a brewing infection, they might want to put you on an oral antibiotic by mouth or a cream on the eyelid. I try to avoid it, but if necessary, we do it. And sorry to interrupt you, but
no, it's fine. So I do like doxycycline. So I might be mildly controversial, but I've had good experience with it. It shrinks. If anything, if there's any medicine out there that's going to shrink the chalazion and help eradicate it, it is doxycycline, in my opinion. I use 1 pill a day, usually for 3 or 4 weeks. I really advise the patient not to have surgery because it can affect the structural integrity of the lid, because these glands are in something called a tarsal plate, which gives the lid its structure. So we like to avoid that. Medications are really, for the most part, useless in my practice. And there is one important thing that you have to be mindful of, which is something called Masquerade Syndrome, where a chalazion seems like, or what you may diagnose as a chalazion is really something else, something evil. And so we worry about this thing called squamous cell carcinoma. And on occasion, I will suggest a biopsy just to make sure that we haven't gone too long, and we don't want to miss that because that can be trouble. But
I would emphasize with that. I mean, in my practice, I've been doing this almost 30 years. I'm a general ophthalmologist, so I'm seeing lots of different things. I've seen, I think, no more than 3 of what Carl's talking about. He's in a referral practice in Alaska. He might be seeing this Masquerade Syndrome more commonly, but we don't want to worry, though. I mean, most styes are styes. I think what he's bringing out is if you have something for a few months and you're soaking it, and maybe even your doctor tried antibiotics, it's not going away, well, at that point, it probably makes sense to have it drained and even biopsied under certain circumstances. But
Right.
we do drain plenty of these, and
Yeah.
they go well, but it's
Yeah.
not pleasant. It's
Yeah.
not a pleasant procedure. It hurts.
Right.
It's not something to rush into. I think that's the most important thing that I
Right.
can emphasize.
Right. No,
If you're
John.
really bothered, or your problem's coming up, which you never know, I'm getting ready. I mean,
Right.
I mean,
100%.
if
100%,
it was
John.
my bar mitzvah,
Right,
a
John.
cosmetic issue at that point.
Right,
But I think
right.
if you
People
can
don't
live
get
with
that.
it and
People don't
get
understand
through it,
that
I
in
think
Alaska.
usually it'll go away.
Right. But right. So I agree. But I do see stuff on the eyelid that is more on a referral basis. So I have that concern. But thank you, folks, for listening. We're going to move on to another topic. We may get back to this depending on your comments. Please put your comments below. But thank you again. And like I said, John, anything else?
I think we killed it this time, huh?
Yeah.
We killed the
Don't forget-
topic.
Yeah. Don't forget to eat carrots, people. All right. Bye now.